Hello, everyone. My name is Haley Smith. I am the Digital Media Specialist for LeadingAge California's The Gateway In Project, and I would like to officially welcome you to today's webinar hosted by our team. Before we get started, I'd like to go over a few housekeeping items. Everyone has been muted to avoid outside noise during the presentation. If you have questions, you can use the chat feature or the Q&A feature and submit your questions throughout the presentation. As we will have some time dedicated to questions and answers at the end of today's presentation, and now I will turn it over to the rest of our team for introductions.
Hi, my name is Nicole. I am the manager of Northern California, and I work with students with wraparound services, but my primary focus is working with the schools. Thank you.
Hi there, everyone. My name is Danny Prastert. I do what Nicole does by helping LeadingAge California to oversee the Southern California region, and together, Nicole and I oversee the Gateway In project for the entire state.
Hello, I'm Anna Smith. I'm the Outreach Coordinator for Northern California. I help support students both in the application process as well as throughout their program.
Hello, my name is Christina McQuillan. I'm the Outreach Coordinator for Southern California. So I help support students located in the SoCal region.
Hi, everyone. My name is Michaela Chappelle. I'm the placement coordinator for the Gateway In project, and my primary role is to help students get jobs with employers after you're done with your training.
Hello, everyone. My name is Haley Smith. I'm the Digital Media Specialist for the Gateway In project, and I help with all things digital for our team.
Now let's go ahead and get right into it. So you're probably wondering, what even is the Gateway In project? Well, we are a grant-funded program that provides free tuition and wraparound services to California residents pursuing CNAs and home health aid licenses. Tuition goes directly to the schools, and wraparound funds go directly to students. Wraparounds are funds set aside for each student for costs you accrue during school. We'll talk about wraparound services a little bit later in the presentation, but first I wanted to give you some background. LeadingAge California is the state's leading advocate for quality nonprofit senior living care. LeadingAge California was awarded over $25 million by the California Department of Healthcare Access and Information, what we know as HCI. This is to implement the Gateway In project, which will add 2,700 certified nursing assistants and certified home health aides into the workforce pipeline through training and job placement. This program is specifically for California residents and will span over a 3-year period, and we are currently finishing up year 1. In California, and honestly just well over the United States, there's a shortage of healthcare workers. With so many aging adults requiring more help at home and entering into senior communities, there's just not enough staff to meet that need. So as a result, LeadingAge California took the initiative to identify and secure funding to address the issue. In California, over 50% of CNAs work in nursing care facilities or community care facilities that serve older adults. CNAs and home health aides play an essential role in these facilities, as well as in in-home and community-based settings. They often serve as the principal caregiver, having the most personal contact with residents over any other staff member, and oftenly enough, family members as well. The Gateway In project will actively promote, recruit, train, provide wraparound services and retention incentives for 2,700 new CNAs and home health aides across the state of California during this 3-year period. Now, I want to make it very clear, we do not partner with every school, nor are we a school ourselves. We partner with specific schools in California that we know care about their students, provide engaging classes, and actively train students so they have a leg up when applying for positions. In July, we are going to start with Pacific Health in Fresno, Alpha First in Santa Rosa, Unitech in Fremont, South San Francisco, and Newport, Class Act in Carson City, and Annenberg in Reseda. As we continue enrollment in August and September and throughout, we will begin classes in other areas of California. But please note, if the school you are interested in does not have a partnership with us, you will not be able to attend that school and receive our funding. We can, however, provide other options in your area if you do want to be a Gateway In project, which of course we hope you do. The Gateway In project doesn't just provide tuition and wraparound services. Our unique approach also addresses the workforce shortage by offering internships to high school students, providing certification prep and study tools, job placement for students who pass their state certification and career advancement. We are called the Gateway In project because we are just the beginning. We are the gateway in, the place to get your foot in the door into the medical field. Once students are working in long-term care, we will offer cash bonuses for employees pursuing additional trainings to really hone their caregiving skills. Thank you. Now I'm going to go ahead and pass it over to Danny Presser, the Southern California manager, and she'll get into the nitty-gritty of things.
Thank you, Nicole. Thank you. Everyone, before I move forward, I just want all of us to take a moment to digest what Nicole just said. Essentially, free training, free money after their training, just for being a CNA and doing what CNAs do. This is real. Nicole mentioned earlier that we will be funding students to attend 5 schools in July. I want to elaborate that what these schools have in common is that they are private training schools with full-time and or part-time classes that range from 4 to 7 weeks in length. LeadingAge California makes a big effort to partner with schools across the state that offers different learning styles to students, because we recognize that everyone learns at a different pace and everyone needs a learning schedule that works for them. For example, working students, working parents, students without transportation, they may prefer to learn from the comfort of their own homes, so they can take advantage of online classes. If students learn best in person, then they can, of course, take in-person classes. Some people work days, hence night classes may work for them. Some people prefer the 9 to 5, get the long days out of the way in order to complete class early, or some people can only take weekend classes. There's lots of options. As Nicole mentioned, after July, we also work with other schools with different schedules offered. These other schools are also either additional private schools or adult schools and possibly community colleges that offer part-time schedule training within a span of 10 to 20 weeks. All schools we work with are approved by the California Department of Public Health, the same government entity that approves students' CNA license. And all schools are required to offer a minimum of 160 hours of CNA training to certify students. If students wish to take a step further into their healthcare career and obtain more certifications, we encourage students to do that. Yes, take an additional home health aid class if the class is available, which is only an additional 40 hours or 1 week, so to speak. Hence, as you can see, if the CNA training is sufficient, then it is only a minimum total of 160 hours of training. You become certified, you take the state tests, now you're a professional CNA. But if you would like the HHA as an additional training, then your total training hours is a minimum of 200 minimum hours to obtain both licenses. Please also note that the home health aid class and certification can only be taken by students who already have the CNA license. All right. Some of you may already know what a CNA does. Some of you may not. In short, a CNA is very important. CNAs are a very crucial part of the workforce and they are in high need. CNAs are supervised by registered nurse or licensed practical nurses. And what they essentially do is assist patients to dress, bathe, eat, take medications, take vital signs, turn them over in bed if they're bedridden, and overall provide a warm and calm presence. If some of you are already doing this in your personal life for a member of your family, then that's fantastic because this means you already have transferable skills to be a CNA. CNAs have a variety of work shifts. They can work mornings, like very early mornings, work days, graveyard, weekends, weekdays, part-time, full-time, overtime. I've even seen a student work more than overtime. Some people can be on call, or some people can work per diem, which is like fill in or substitute for other CNAs who do not come into their shifts. They can also work more than one facilities or do more than one shift. In short, there are many employment options for CNAs, and it all depends on the worker's desire to work as much or as less as they possibly can. I would also like to reinforce what Nicole talked about earlier regarding the fact that CNAs are sometimes the only people patients get to see and interact with all day, simply because the patients may have working families who cannot come to see them all that often, or they may not have families at all. Then this is why the CNA professional is more than just a job. It really is a calling. Being a CNA requires patience, it requires tolerance, and it requires a willingness to help other people in need. Okay, now, how is being a certified home health aide or HHA worker different from a CNA? Well, the additional certification enables a CNA to further diversify their work settings. HHA workers can help a patient in a non-medical setting, like in the patient's own home. The shifts for an HHA worker is even more diverse. HHA workers can work 4 hours, 6 hours, 8 hours, or even 12 hours at a time, depending on the agreement and the assignment. Being an HHA allows the CNA to provide more personalized assistance. For example, instead of being assigned to help 8 to 10 patients per day at a facility, an HHA worker assists 1 patient at a time during their work shift. The flexibility in scheduling allows the HHA worker to spend more time with their own families, pursue hobbies, work other jobs, or take further educational classes, and so forth. Furthermore, HHA workers and patients often develop great relationships. We know this because we have spoken to many HHA workers, and they can attest that the favorite part of their job is getting to know their patients and taking care of their patients as if they are a family member. As a professional, you will know that you have a very rewarding job if you truly enjoy what you do and the people you serve. Okay, all right. Now I'm going to popcorn the next topic over to Christina.
So I'm going to be going over the eligibility requirements. So one of the great things about the Gateway In project is it's pretty easy to qualify. You just need to be at least 16 years of age, have a valid identification and a social security card or an ITIN number. You also have to have a commitment to completing a California Department of Public Health approved training program and to receiving state certification. Once approved into the training program, you will need to obtain criminal record clearance through a background check or fingerprinting, provide health records, and proof of COVID vaccinations. Some training schools may require boosters within those COVID vaccinations, but it does vary by location. You will also need health clearance by an examination and negative TB test. And lastly, you will need to commit to providing care and services to the aging adult population for at least 1 year. Next, I'll be going over the overall application process. So the application process is actually pretty easy. Once you submit an application, you will attend a hosted webinar, which is what you're all doing here today. So congratulations, you all are already on step 2. After the webinar, you'll receive a student information packet with the PowerPoint shown here, contact information, a student checklist for your reference, and a student agreement form. The student agreement will need to be signed and then sent back before you can have your phone interview. Once you receive your student agreement, coordinators will then call all the students to conduct their phone interviews. On that call, we will be able to match you to a school and class and let you know whether you've been approved or not. After the call, we will send you your official acceptance letter and let the schools know you're ready to begin class. Next, I'll be going over some of the successes we've had over the last year. So as of today, we've had over 3,000 people apply for the Gateway In project. We've already had over 1,000 acceptances and graduates throughout all of California, which includes over 800 students receiving their CNAs, over 80 receiving their CHHAs, and then over 200 receiving their dual certification in both. We're excited to be able to add you all into the Gateway In project family. Now I will send it over to Anna, and she'll be going over wraparound services.
Thank you, Christina. Before we dive into this topic, I want to give you a warning. This is a service we receive the most questions about, and we're going over a lot of information today. So I want to take this time to encourage you to take notes as needed and feel free to leave any questions that you have in the chat. We understand that the cost of tuition is not the only concern when thinking of committing to school. There are so many additional costs that add up quickly. To help you be successful in school, we will reimburse you up to $3,000 that can cover any school needs. We call these your wraparound dollars. Let's get into the specifics of what is covered and how exactly you get reimbursed. It sometimes feels impossible to succeed as a parent, and we understand the need of having reliable childcare when taking a new step towards your career. We will cover any certified childcare fees. It is important to note that this cannot be a parent or a friend watching your child. If you need assistance finding certified childcare, reach out to your outreach coordinator. That'd either be me or Christina for help. We also cover mileage to and from school, training sites, and childcare on the days that you attend the program. We will help cover bus passes or the occasional Uber or Lyft ride if there are no other travel options for that day. Reach out to your outreach coordinator for help if you need clarification. We also cover up to 3 meals a day, and this is the only category that you do not need supporting documents for, as it is a stipend. Breakfast is $15, lunch is $20, and dinner is $30. We also help cover any test prep and tutor needs. Reach out to your outreach coordinator for study tools if you don't have any. School costs, scrubs, textbooks, live scan, registration fee, nurse badges, the list goes on. Although some programs cover these things in their tuition, not all schools do, or you may need more than what is provided. Your wraparound dollars cover this. Just keep track on your reimbursement forms, and again, keep your receipts. But how do you keep track? Let's go over what a reimbursement form looks like. This is an example of a correctly filled out reimbursement form. As you can see here, the student had to get a live scan done on January 10th, 2023. A correctly filled out form always has the date, the description, the cost, supporting documents, and a signature. You will receive a reimbursement form once you are accepted into the Gateway End project. As you go through your program and pay for things, keep track of all expenses by using this form and saving your receipts. Now let's dive into mileage reimbursement. This is the portion of reimbursement we get the most questions on. When it comes to mileage reimbursement, we do not need receipts. However, we do need screenshots of your mileage, like the ones shown here. The mileage does not have to match the exact number, as we understand that it does not always account for road closures or additional stops. Keep it simple. If you stop along the way, only use your main starting and ending location. Go off your odometer to account for those extra miles. If it is within a reasonable range, we will reimburse you. Make sure to account for round trips and always double check your math. Take your time filling out this form to prevent it from being rejected. And always reach out to your coordinator, me or Christina, if you have any questions or need help filling out this form. This is a lot of information, and we do not expect you to remember this all now. Once you are fully accepted into the program, we will send you a breakdown of what is covered, how to fill this form out, and the reimbursement form itself. We are always here for questions along the way. Thank you so much for your time, and I will now turn it over to our job placement coordinator, Michaela Chappelle.
Okay, thank you, Anna. Hi, everyone again. As Anna mentioned, I'm the job placement coordinator, and I'm going to go over what happens after you complete your training. So the Gateway In project will pay for your state exam and any test prep services. We offer test prep online where you can do practice quizzes and things like that. We offer help creating and updating your resume and helping you search for jobs. And our project also works with many long-term care providers that want to hire CNAs right out of the training. So how does all of this work? As the placement coordinator, I will send your contact information and your resume to these providers and make the connections for you. I will also direct you to apply online for their open positions. And ideally, you will start this job search while you're still in training so that when you complete your training, you already have a job lined up to go right into. If you don't find a job through us, but you find one on your own, that's also fine. As long as you're working for an eligible employer, you just need to update us on the employment so we can get you your bonuses. And now let's take a look at the bonuses we offer. Our program gives all Gateway In project graduates a retention bonus, which we also refer to as an incentive. for being employed in a long-term care facility that's working with older adults. And if you're wondering what a retention bonus means, it is just free money, basically. It's nothing that you have to pay back. We give you this money as a way to congratulate you on your new employment and also encourage you to stay employed. So when you reach 1 month of employment, we give you a $500 bonus that's either paid by check or direct deposit. And we give you another $500 when you reach 6 months of employment, and then again at 12 months of employment. And in order to get these bonuses, you'll have to keep in contact with us after the training ends so that you can update us on your job. And you also need to work for an eligible employer. So let's look into the qualifications a little further. So how do you qualify for the retention bonus after you begin working? Well, since the purpose of our grant is to get more CNAs employed working with seniors, the retention bonuses are only given if you have your CNA certification, meaning that you passed the exam, and if you're working in a facility that cares for older adults. Our focus for this grant is on long-term care, not acute care. So a setting like a hospital or a doctor's office would not qualify for the retention bonus. If you are working in a community such as a skilled nursing home, adult daycare, at-home senior care, or a retirement community, those are all examples of jobs that would qualify for the $500 retention bonus. If in addition to your CNA, you get your home health aide certification, then working for a home health agency or a hospice will qualify as well. And you can always reach out to me if you have any questions about the employment bonuses or if you need any help with your job search. And now I will turn it back over to Haley so we can go over some questions.
Thank you, Michaela. I appreciate it. In just a moment, we will begin the Q&A portion of our webinar. We've been monitoring the chat. We haven't seen too many questions yet, so if you would like to type in some questions now is the time. We have the Q&A format and also the chat. You can just message a question. We'll review those in just a moment. This slide shows links and hyperlinks to the Gateway End Project homepage on the LeadingAge California website. Our FAQ page with commonly asked questions and answers, our wraparound service reimbursement guideline, and our team email where you can email our entire staff for general questions and answers. Our next slide will show all of our contact information if you would like to get in contact with one of us specifically. I will pause on that next slide to allow you to screenshot or note our contact information before coming back to this slide to allow for questions. Don't worry if you don't screenshot or get the information in time, as we will be sending this and a copy of our slides for your reference. And now I will go back to the previous slide where we will facilitate additional questions from you. All right, I know that we had a few questions. I believe, let's see, the first one we had, I think Nicole or Danny, could you answer this question? Are COVID boosters required?
All right, I can go ahead and answer this. So that question is going to depend on which school you want to attend. Each school has different guidelines, especially with COVID. So some schools require no vaccination at all. Some schools require a vaccination, but they don't care about the booster. And some schools require a booster. So once you have your phone interview, you can go ahead and talk with the coordinator about that. And they have that information on what the schools require, so they can give you a better answer, a specific answer that matches the school's requirements that you hope to attend.
Thank you, Nicole. Danny, can you address this next question? What schools will the Gateway Project fund?
We fund schools that are CDPH approved and certified, and we also fund schools that meet certain criteria when we're looking for partnerships throughout the state. As Nicole mentioned in her speech, the school needs to be able to show us that they have the ability to engage students and offer diverse education for a lot of students' learning needs. That being said, private training schools, adult schools, community colleges, these are the institutions that we will fund, as long as they're in partnership with our program, then we will approve the students to attend the school. You will be able to know more specific information once a coordinator is in touch with you to interview you for our funding and provide more specific information.
Thank you, Danny. Now this one could be for Danny or Christina, but could we repeat the SoCal schools that we will be beginning with in July?
I can take that. Yes. So in July, we will be starting off with 2 schools, one called Annenberg School of Nursing located in Reseda, and another called Class Act Training Center located in Carson.
And then Nicole, could you repeat the NorCal schools again for our webinar attendees?
Absolutely. So we are going to begin in July with Pacific Health in Fresno, California, Alpha First in Santa Rosa, and Unitech in Fremont and South San Francisco. We do also have a location for Unitech in Newport as well that will be opening toward the end of July, early August. And then we do have other schools that we will be partnering with towards September and August, and those schools are going to be in Sacramento. We have one called Alveo Med, and then we have a school in Monterey. We have another school in Fresno called Nursing Assistant Training Academy. And so we do have a lot of options. We have one in Merced for Northern California. So we are all over California. As we continue to develop those partnerships with schools, we will continue with more options for our students.
Thank you, Nicole. I do see we have a question for Michaela. Will the careers require a certain time commitment? They're still in school and they might not be able to work for long.
Yeah, so for the retention bonuses that I mentioned, we do it for a year because we do ask that you work for a year with older adults. But that being said, you can choose your own schedule. You can choose where you want to work. If you can only work part-time or on call, all of that is okay. You don't have to just work full-time, and if that doesn't fit in with your schedule in your life.
Thank you, Michaela. I see we have another question. Perhaps Christina could talk about this subject. Are the classes close to being filled for July? Will some people be turned away due to this reason? And what are some of the reasons that applicants might get rejected?
Yes, that's a great question. So a lot of that will depend on the training partner that we do match you up with. When we go through that phone interview, we will be able to kind of let you know and give you a good estimate of how many people are going to be in that specific cohort and be able to really match you with a cohort and training school that personally fits your specific needs. So besides that, some other reasons you might not be accepted wouldn't necessarily be on our end. It might be through the training school itself, depending on their requirements, as we mentioned before. COVID vaccines with boosters, TB tests, different things of that nature. However, we do encourage everyone, if you don't make it into this round of cohorts, we do keep all of your supporting documents and information if you do want to go ahead and apply again.
Thank you, Christina. Danny, could you talk a little bit more about the schools that we might have in the Inland Empire or San Bernardino or even in La Puente area?
I believe the closest school to, for example, the La Puente area is either Pasadena or Carson. Again, we do have a wide variety. Some schools are online, theories, in-person clinical. Some schools are in person. So we will try our best to match students based on the availability of, for example, whether students have rides to school or not. We do have resources that we can help students. That being said, Inland Empire, we are working with a school after July that is located in Riverside, San Bernardino, and to hop on that, additional schools located in San Diego. Kern is upcoming, Bakersfield, and we're also looking forward to even Ventura County. So we do have a lot of options. And we will be updating students as we continue enrolling students throughout the year.
Thank you, Danny. I do see this. Is this training for low-income residents only? So I'll let if Danny or Nicole or even Christina wanted to touch on that.
Yes, I'm sorry, Nicole. Yes, that's a great question. So we don't ask for any banking statements or any proof of income. So our program really is open to anyone.
Wonderful. And then I see this question about was it the Monterey classes that are starting in September or July? Nicole, would you have that answer?
Yeah, that will actually is to be determined. So it definitely won't be in July, but we are working with the school to see when we could start classes.
Wonderful. I do see we have a few more questions. Let's see if I can find them. Michaela, could you answer if they can qualify for a bonus if they only work part-time?
Yeah, you can qualify for a bonus if you work part-time. The other requirements have to be met. You have to work in a long-term care facility, but if you work part-time or on-call, as I mentioned before, it still qualifies for the bonus as long as you're working with older adults.
All right, I see another question coming in for Danny. Would there be schools located in the LA County that will be beginning, I'm guessing either in July or even after that?
LA County is very large. So schools located in LA city itself, we are working with a school that is in Inglewood. They don't have classes in July, as far as I know. The other school available, as mentioned earlier, is a school located in Reseda, San Fernando Valley, as well as Carson, which is in the South Bay. So it really depends on the class schedule. We don't determine class schedules when schools are the one who determine class schedules. Essentially, we only work with the schools to have an internal referral system between students, school, and us to ensure that when students start class that they are funded and vice versa. I hope that answers your question.
Thank you, Danny. Christina, could you answer this question? They're already a CNA or they already have their CNA certification. Can they just do the HHA certification through us?
Yeah, that's a great question. So once you go through your CNA process, you are able to then go ahead and get your HHA. As Danny had mentioned in her slide, that is just about 40 additional hours. So it's not a whole new 200 hours. It's just that additional 40 hours that you'd have to do to earn that certificate as well.
Thank you, Christina. Nicole, could you address this question? Can I use a previous TB test from within the last year, or do I need to do it again?
That is a fantastic question, and I'm so glad someone asked that because the answer is going to vary. So to give you a safe answer, I'm going to go ahead and say no. It's best to just get another one. It depends on the school. So each school has different requirements, like we've said. Some schools require a TB test to be done within 3 months. Some require a TB test to be done in 6 months, and some require it to be a year. But what I will say is that most of the schools, you have to have a fresh TB test within the last 3 months. Great question. And then to add on that, your physical as well. A lot of schools will have a specific form that you need to fill out. So even if you have already had a physical, a month or two ago, you will most likely need to get a fresh physical and have the doctor sign off on the form that the school provides.
Thank you, Nicole. Danny, again, for the Southern California area, for the Inglewood area, do we have a tentative date that training would begin and we would begin opening enrollment?
At the moment, I do not have a definitive date, but I'm pretty confident that they will have a class in August.
Thank you, Danny. Christina, could you answer this question? Do you cover household bills as well?
That's a great question. So we do help with some household bills. especially for instance, Wi-Fi. So if you are taking an online course, needing to use your laptop or phone to access Wi-Fi, or even Wi-Fi just to study, even if you are taking an in-person class. So we do help support some household utilities with your wraparound.
Thank you, Christina. I see a question about Alpha First specifically. So if Danny or Nicole wanted to answer this, does Alpha First offer hybrid courses? For example, some days in school and some days online?
That is a great question, and the answer is yes. So they do prefer students to come into the classroom. So I'm going to back up for a second because I want to make it clear about the hybrid courses. So we do have classes that are completely in person, but we do not have classes that are completely online. So each class consists of two parts. One part is going to be the theory portion, which is like your lecture. The second portion is going to be the clinical, which is your lab. It's your hands-on experience. In California, that lab portion is required to be in person. So the hybrid courses are theory online and clinicals in person. So for Alpha First, they have an option to do their theory either in person in the classroom or online, depending on what you prefer, but the clinicals will be mandatory in-person training. Great question.
Thank you, Nicole. I think I just saw another question. Okay, just a thank you. Yes, of course. We're happy to answer any questions you have. If you have them, please continue to send them in. I'm going to scan again. Where did I leave off? Nicole or Danny, because you have the bigger scope of these things, what are the schedules of the classes?
I can respond to that.
Thank you, Danny.
So again, once again, really depends on the school that's offering the courses. Some schools offer accelerated courses. So you can take a CNA class for 4 weeks straight, full time, every single day, except Monday through Friday, and be done within a month, but it's very fast paced. Or some schools can range to 6 weeks or 7 weeks because maybe they're stretching the hours. It could be a 6-hour per day course, 5-hour per day course, depending, just so working adults can perhaps take a night class or a morning class. So it really depends. Once again, we've seen this type of length in adult schools and community colleges. The classes can be anywhere from 12 weeks to 20 weeks. And that's because adult schools and community colleges are offering more than the minimum of 160 hours of training. So a lot of other lessons, a lot of soft skills, a lot more lab training are provided in the adult school and the community college setting. So again, really depends on the need of the student, how much longer you have time-wise, that is, to devote to training, how long you can stay away from work to get a certificate. It really depends on the student.
Thank you, Danny. Christina, could you address this question? Is there a difference between applying with a Social Security or an ITIN number?
Oops, sorry, I didn't unmute there. That's a great question. So either of those are just part of your identification materials that you will need to apply. So it's either or.
Thank you. And then Michaela, just to confirm, once they are CNA certified, are they able to work at any institution within California?
Yes, so you can, once you have your certification, that is yours. You can choose to work wherever you want to. The benefits of working in long-term care is for remaining part of the program. You'll still get some wraparound services for getting to work. You'll still get the employment bonuses and things like that if you do work in long-term care with older adults. But you will have your certification once you complete it. You can choose to work at any job, any institution that is hiring for CNAs.
Thank you, Michaela. And correct me if I'm wrong, Danny, I see this question about the Reseda location. Is that the Annenberg location? And is it a 4-week program?
That is correct, Haley. It's a 4-week program, very quick, very accelerated. They also have an HHA course there for an extra week that students can take after they complete the CNA program. They also have connections with other employers as well that they can help students to transition to after the training. So yes, indeed.
Thank you. Christina, could you answer this? Is there an income cap for applying and being a part of the Gateway In project?
That's a great question. So we don't check any of your income or banking materials. So really anyone is able to apply and become a part of our program.
Thank you. And then Nicole, could you answer this question? Are online classes asynchronous or do they require Zoom?
Again, a great question. I'm loving these questions. These are amazing questions. So to answer your question, they are not. They do require Zoom. So it is a virtual classroom where you are expected to log on. Let's say the class is from 9 to 3. You are expected to be on your Zoom from 9 to 3 in an area where it is quiet, hopefully at a desk, even if it's a kitchen table, as long as it's quiet. And you have to have your screen on. So you have to be actively participating in the course. Great question.
And then Michaela, we have this question. If I only need to do the HHA training, do I still get to use the full $3,000?
Yes, that $3,000 is for every student that goes through the Gateway In project. So you will still be, you still have the same amount of wraparound dollars.
Thank you. I don't see any new questions, but I'm going to give it a few moments and see if we have any final questions. So if there's anything you're waiting to ask, please ask it now. I do see that one of our, Patricia has a hand raised. And if you have that question, if you want to type that into the Q&A, we are more than happy to address that question. Giving them a second to type. I know it takes a while, so no worries here. Just to confirm, this is a question that I'm just thinking of for Zoom that we asked about. Can we help with Zoom? I know that we are helping with Wi-Fi, so that's something I think that they might be thinking about too, because I know sometimes a Zoom contract is a purchase too.
Yeah, I can go ahead and touch on that. Yes. So wraparound dollars, the amazing thing about them is, first of all, there's a lot. There's $3,000, and that does not include tuition. Your tuition, like I said in my first slide, that is paid directly to the school. Your wraparound dollars, the $3,000, is separate from that. Those are for really anything that you are going to need in order to be successful in your class. So if your class is online and it does require Zoom and you do not have a Zoom account and say you have to purchase one, that's not a problem. We can reimburse you for that. If you have an old laptop that it just isn't working, it doesn't even allow you to access Zoom, things like that. Most of the time, the schools do require online trainings as well. So although you're doing Zoom Classroom, you're also working with software like Canvas, where you are doing online quizzes and things like that. So a phone, most of the time, does not work. So I'm glad you brought up that question, because for students that do not have a laptop or a tablet where they can access these softwares, we could actually go ahead and purchase one on your behalf. Like I said, we just want to make sure that every student that goes through the Gateway In project is successful, and we are willing to do whatever we can within reason in order to help students out.
Thank you for that, Nicole. I appreciate it. I did have that question about who they could reach out to about the Monterey area schools. And I did just want to say that that answer has been, that question has been answered. And I let everyone know Anna and Nicole are for the Northern region. While we are all here and can support the entirety of the state of California, if you wanted a more specific answer to that Northern area, then that would be Nicole and Anna for that. Yeah, we do. Some of our schools do offer online courses, Patricia. So if we can match that with you during your phone interview, please let our coordinators know when they reach out to you that you would like to have an online course, and we can work with you on that and match you to the appropriate school in your area. One of our questions, and I think I will have Nicole answer this one, can all of the training be done online?
That is a great question. So for your license, you will need to do clinicals, and clinicals do have to be in person. So Although we have trainings that are completely in person, if that's what you prefer to do, we do have options for students to do their part of the class online and part of the class in person. So these are separated by your theory portion, which is like your lecture, and then your clinical portion, which is your lab hands-on training. So for most of the classes, the theory portion can be done online. However, clinicals always need to be done in person. Great question.
We have another question. Danny, if you can answer this one. If we are applying for the July 10th start date, when will we be notified if we are accepted for that session?
Oh, thank you. Thank you, Haley. You will be notified a minimum of 2 weeks before the class start. As a matter of fact, the reason why we are doing this webinar today is so that we can get a very much head start. Once our coordinators reach out to you for an interview, which will be within the next 2 to 3 weeks. Within the week following that, you will find out whether you will receive the scholarship or not.
Thank you, Danny. Nicole, we have another question. What cities in California will this program cover?
Great question. So we are trying to have pretty much every county, but not necessarily every city. So some students, for example, if you're in Madera, California, you will have to travel about 20 to 30 miles to get to Fresno. So we usually have them in bigger cities. Right now we have Sacramento, Santa Rosa, Monterey, Fresno. Danny, you can hop in for Southern California, Los Angeles. We have them pretty much all over Northern and Southern California.
Correct. Just to add on to Nicole's statement. So we are going to be covering Kern, Orange County, Riverside, San Bernardino. We're looking into also additional sites in San Diego to diversify schools, possibly the Santa Barbara as well as Ventura County. So definitely a lot of updates to come.
Danny, while we have you, can you also address how long the trainings are?
Yes, thank you, Haley. The trainings, it really depends. If you take a full-time class, this could range anywhere from 4 to 5 weeks. If students prefer a part-time class, meaning that a class is perhaps only 4 to 6 hours each day, then the entire training may turn out to be a 7-week course. Finally, depending again, students choosing to attend CNA training at adult schools or community college, these trainings can range in length from 12 to 20 weeks. Just because the class time is shorter, it's designed for working adults or students taking another class. And so in general, it really depends on the amount of time that a student can dedicate to a training and the amount of time that they can also fit in with their lifestyles.
Thank you, Danny. Anna, could you address this question? What will be the reasons to not be accepted in the program?
Luckily with the Gateway In project, we accept almost anybody. The only barriers really to not being accepted is primarily the school's process. So certain schools require COVID vaccinations, certain schools require boosters. So you would have to make sure you get everything cleared on that side. But with us, it's a really simple application process. There are not too many barriers. So if you've applied and got to this point, after this, we'll conduct a phone interview and you could ask any questions that maybe you're specifically concerned about. You should be fine.
Thank you, Anna.
Just one thing to add to that, a lot of questions that we get are, is there an income cap for being qualified? Because we are providing scholarships and wraparound services. To answer your question, there is not an income cap. So we don't ask, we don't need to see how much you make. We don't need to see what's in your bank account like some other scholarships do. For us, we do just ask that you are above the age of 16 years old, you are willing and wanting to and have the heart to work with older adults, and that you have the commitment to start classes, finish classes, and really put in that effort to be not just a wonderful CNA and home health aide, but going above and beyond, really having the heart to care for these residents.
Thank you. I do see we have another question. What time and days are classes usually offered? Christina, could you take a stab at that one, please?
Yes, of course. So with our different training programs, we do offer kind of a wide range, or they really offer a wide range of different dates and times. So typically, if it's maybe part-time, they might have night classes after work if you are working for full-time as well. As for more full-time training schools, it might be more so during the day, kind of from the morning into the afternoon. So this really would depend on, you know, your schedule as well. So when we do go over those phone interviews with you, really letting us know kind of your schedule and what's going to fit best for you. And we'll try to match you to the best of our ability with the best training program for you.
Thank you, Christina. We had another question. If Nicole could address this. They're wondering if there's a chance to start the program earlier. They've been in contact with one of our schools, plan to go in, and there's already holding a spot for an earlier session. Could you address that?
Absolutely. So right now, unfortunately, you would not be able to start classes before July. For our program, you do have to apply with us and get approved with us before you apply with the school. Now, some students will talk with the school. The school will say, hey, I understand you're struggling with money. The Gateway In Project is a great resource, and that's okay, you know, but you do need to register with us first. And right now, enrollment is closed until July 1st.
Well, thank you. Thank you, Nicole. Michaela, we have a question regarding job placement. So I'm just going to read one of them. Do you need to get hired through the Gateway In Project, or can you find a job on your own?
Yeah, you do not need to get hired through us. We are here as a resource to help you get a job right out of training, because we work with a lot of partners and providers who are familiar with our program, and so they are more, they're likely to hire you. So it's just a quick connection to get you into a job. But if there's somewhere else that you're looking at that maybe we don't have a partnership with, or you just find a job on your own from online, that's totally fine, as long as it qualifies being a long-term care facility or working with older adults. Then you still get the retention bonuses and things like that. But if you find a job on your own, that's fine.
Thank you. And then Anna, could you address this question? Can I get reimbursed for having my mom watch my kids?
Unfortunately not. We only cover certified childcare. If you are having a hard time finding childcare, we do have resources and partners we work with, and we can help you connect with those resources.
Thank you. Christina, could you address, will mileage be covered to clinicals or just to school?
Yes, that's a great question. So your mileage will be covered to and from your clinicals, as well as to and from school. So we will be reimbursing you for both clinicals and class.
So you go ahead and add on that too. I get a lot of questions about that as well. And we could actually reimburse your mileage to and from childcare. If that helps, we could reimburse your mileage to and from your graduation, to and from getting your life scan, to and from getting your physical. We really will reimburse mileage as long as you are working, or as long as you are doing something and traveling, because it is related to your training.
Wonderful. We got a few more questions coming in. Danny, could you address when the program is starting officially again, and is it free?
The program will officially start after July 1st. And as mentioned, because of the fact that we pay tuition, wraparound dollars, the program is entirely free for students who are accepted to receive the Gateway In Project funding.
Awesome, thank you. And then we have a very unique question. So I think it would be between Nicole or Danny, whoever would have the most insight on this one. Can we get a chance to train as a CNA while overseas? They're in Dubai, but they're very interested in joining this project.
That is a great question. And unfortunately, the answer is going to be no for two reasons. One is that our trainings are only partially online. And so you do have to have clinicals. You do have to do clinicals in person. And the clinical partners that we work with are only in California. The second reason is because once you graduate and pass your state exam, We do ask that students work with senior citizens for at least 1 year. On a side note, we do provide retention bonuses for that to help you out, along with all the amazing things that you'll get from your employer, such as bonuses and having an amazing work culture and having that support. But you do need to work with senior citizens in a long-term care facility, or if you're working in HHA, as long as you're working, in the home doing long-term care. So we do ask that you do that. So because of that, I'm not sure about your circumstances, but it sounds like you may not be able to fulfill that requirement. But we can talk more about that.
Thank you. Yes, if you want to talk more in depth about that question, please message on our Gateway In Project email and our member of our staff will get back to you. I see a couple more questions coming in. So I think it'll be Anna or Christina to answer this one. How does the childcare work? Can you explain that a little more?
Yeah, of course. So with childcare, we want you to pick a childcare that you feel comfortable with and that you've vetted. But we understand that resources are not always available, or you're not sure, where to get started. So if you're not sure what childcare you'd like to place your child in, we have resources that I can connect with you on and can send you a list of providers in your area. We also have been partnered with a recent app that can help you out there. It's kind of the Zillow for childcare. That's what we've called it. So you pay up front. Everything is on a reimbursement basis. So you would have to pay up front, and you would submit your receipts to us, and then we'll reimburse you that cost. Again, up to $3,000 of wraparound dollars is what you have. And then if I can just answer the question, because it's from the same person and it's regarding reimbursements, regarding the live scan. So the question is, since we do have to do the live scan, can we start that process now? From that question, it sounds like you've been in communication with the school of the requirements that they need. You can absolutely do that now and keep your receipts, but it's important that you first get accepted by us, and we connect with the school to ensure that we are going to cover your tuition. So I'm not sure if you've already been accepted in the program with that school, so we could touch base if you'd like to reach out to me. But yes, you can go ahead and get your live scan now and keep your receipts.
We have another question. How do I register for the program? Christina, could you touch on that?
Yes, of course. So registering for the Gateway In Project program, you have already filled out your application and have attended this webinar. So again, congratulations, you're already on step 2. So after this webinar, we will be sending out some materials to you that will include this PowerPoint, some student agreement forms, our contact information, and different things like that. So after you do receive that, we will need you to return your student agreement form to us. And then from there, we'll be able to go ahead and schedule your phone interview. And then during that phone interview, we'll be going over the classes, training programs, and different things with you. And then during that process, we'll let you know if you've been approved or not.
Thank you, Christina. Michaela, we have a few more questions about work post-grad and even during the graduate process. So there's kind of a two-parter one. I think they're both related, so I'm going to read them both out. One of them is, for the work bonus during the 1 year, do we need to work a full-time or a part-time job, or will part-time work as well? And then if they're currently working at an assisted living and still plan to work there, would they then be eligible for the bonuses, or do they have to change jobs?
Okay, thank you for that. So for the first question, which was, do you need to work full-time or part-time? You can work anything. It doesn't matter if it's full-time, it doesn't matter if it's part-time. Even if you're on call where you come in to work sometimes, as long as it's for a community that is working with older adults, then you'd still be eligible for the bonus. We do ask for 2 pay stubs to show the amount of time. If you're paid biweekly, we'd ask for 2 pay stubs to show the amount of time you've been working there, but it doesn't matter what your schedule is like. And then for the second question, if you are already working for a facility that would qualify for the bonus, to qualify for it, you have to use your training and your CNA certification in your job. So if you're working there now and say you're a caregiver, and then you do the training, you get your CNA certificate, and then they bump you up to be a CNA, then you would still qualify for the bonus. You just let us know your new job title, along with your pay stubs, and you would still qualify to have that bonus as long as you're using your certification in your job.
Thank you, Michaela. We have another question is if I've went to the school, filled out the application, and also brought all the needing documents, does that mean that they're already registered for the program? Could Nicole or Danny touch on this?
Yeah, I can go and touch on that. So no, for the school, it is a little bit different how they do their process, but for us, you do need to register with us. And just because you complete the application does not mean that you are accepted. That is just the application. We still have to conduct the phone interview. We still have to receive the student agreement from you that says that you are committed to this program and that you are willing to follow our guidelines. Give us, some data that we may need, hearing about your certification and your job placement, things like that. So if you started that process with the school, that is great. You are one step ahead. However, that does not mean that we will cover your tuition. You still have to be approved with us. And I would suggest that you do not believe you are approved until you get that official acceptance letter from us.
Thank you, Nicole.
Haley, I'd also like to add on top of what Nicole stated, for clarification, our program is not partnered with every school in the entire state. We are only partnered with a selected school. So it's also very crucial that your school has to be an official partner with LeadingAge California in order to receive funding from this program. We do get questions, for examples of students who choose to attend schools that we are not funding. There's a lot of reasons why, for example, schools and LeadingAge did not partner up or did partner up. Our goal is to, again, be able to cover every county that has a high need for CNAs in the entire state, which can explain why we are not partnered with a school that perhaps you had signed up but is not partnered with LeadingAge. So in your case, I would suggest, as Haley mentioned, feel free to write us and ask your questions so that we can talk to you more on a case-by-case and provide you with more information.
Thank you, Danny. Just to again touch on the Dubai question, another Dubai question came in. So if Nicole, if you could address this, just because we did answer it before, is there a way for us to sponsor them coming to the USA and study CNA overseas?
That is a great question as well. And I will say, unfortunately, the answer is going to be no, specifically because each student is allotted a wraparound fund of $3,000. And if you were to come to the United States for us to sponsor that, as well as, get you an apartment so that you can study and then stay for a year, I would assume that that would go over the $3,000 budget. But again, you can touch base with us and we can talk about that privately in a little bit more detail to get a little bit more information. Thank you.
Thank you, Nicole. I see another question. I think, Anna, if you could touch on this, does your program also offer CPR training or BLS card?
No, we do not offer that, but we, again, can help you find resources if you're having a hard time finding those on your own.
Also, one thing to add to that as well is that each school has different requirements. So one thing that all the schools that we work with have in common is that you do need to pass a live scan, which is a background check, a physical, and a TB test. Now, some schools require COVID vaccination, some schools don't, some require boosters, some don't, some have other requirements. But some schools themselves do offer CPR and BLS training that is part of their program. So that will be covered in tuition. Now, if a school does not require it, but they want you to get it and they don't offer it, that's not a problem. Like Anna said, we can connect you to resources and we could also cover that cost.
Thank you. I see we do have another question. Maybe Danny can touch on this. How much is the average pay per hour for working as a licensed CNA or HHA?
Good question. Thank you. It really depends on the region that you live in. Some regions have a higher cost of living than others. And so the pay rate for a CNA is reflected into that cost. So in general, what we have seen, the pay rate is $19 and above. And this also factors in if you're a new graduate, for example, if you're a new CNA, you don't have any experience, then of course, as an entry-level worker, your pay may be a little bit lesser than a CNA with more experience, or a caregiver who is finally licensed with a CNA certification and or home health aide, and is taking that step as an official CNA worker. So all these factor into how much you get paid. What we would also like students to consider also is that when looking for work, pay sometimes is not the only factor that you should consider. So if you're offered benefits, if you are offered other incentives to work at a facility, lots of facilities offer 2,000, 3,000, 4,000, 5,000 bonuses for the year to sign up to work for them as a CNA. So factor that into the pay rate plus the benefit, and you can see that perhaps your benefit can actually be much more than what you're being paid for. But again, to answer your question in short, anywhere from 19 to 25 per hour, depending on where you're at.
Thank you, Danny. I do see we have another question. If Anna or Christina could address this, if we don't happen to get approved for this next school session that is starting in July, are we allowed to reapply for another or for the next available session?
That's a great question. Yes, you are allowed to reapply. Well, you don't technically have to reapply. We'll keep your application on file if you just communicate to us what cohort dates you're looking to attend, and we also will communicate with the school to make sure the dates align for what you would like. We'll reach out again if you've already been approved, and again after this we'll call you and conduct a phone interview and go over those details.
And just so you know, cohort is class, everyone. So I just want to make sure we know.
Yes. Yes, this common language. Yes, cohort is class.
Can we go back to the slide that describes the HHA process if possible? Because I do see a question about how does HHA work, and then how long the program takes. So if we get to the program hours 1, 2, that would be great. So I'll wait for us to get to that slide. There we go. So here's the hours of work. If you go back one more, there we go. So here's the average hours to complete your program. So you know it's based on an hour basis, like the slide details. So it can take a number of days or it can be really quick depending on how you go through the program. But this is the average hours to complete the program. If Nicole wants to touch a little more on that.
Thank you, Haley. This is a really great question because it's different for each school. So some schools that we work with offer full-time, and some offer part-time, some offer accelerated programs. So for example, an accelerated program would only, the 160 hours would only be 4 to 5 weeks long, Monday through Friday, 8-hour days. A part-time class could be in the evenings, and that could take about 6 weeks. And a weekend course can take about 16 weeks. So it's really anywhere between 1 month to 3 months at the longest for your CNA license. So that's pretty fast. And when you see here, it says certified home health aide 200 hours. That is not 200 hours on top of the 160 hours. That is only 40 extra hours. So not every CNA has to pursue their HHA, but if you want to have it, it's an excellent resource. It's an excellent thing to have under your belt. And it really shows that you have a variety of skills when you are looking to apply. Now, the 40 hours for HHA are typically done through a Monday through Friday 1-week course, to answer your question.
Thank you, Nicole. Christina, could you touch on this next question? Is there any way we know that we're guaranteed to start class in July?
So unfortunately, at this very moment, I wouldn't be able to guarantee that you all would be accepted and being able to start class in July. However, just to reassure everyone, kind of just going through the process, we would really just need you to look over the materials that we'll be sending you out after the webinar and getting us back your student agreements as soon as you possibly can. So that way we can begin conducting those phone interviews with you all. And kind of after that process, we'll really be able to let you know if you're accepted into the program or not.
Okay, I don't see any more questions. I'm going to give it another second or so since we did get a couple more of those last minute ones. Of course, you're welcome, Patricia. Okay, I'm not seeing any more questions. We want to thank you all for joining us today in this webinar. Please keep an eye on your email. Next week, we should be sending out more information such as those welcome packets. Our coordinators will start reaching out soon, so just keep an eye on your phone and your email for that kind of contact, okay? Thank you so much, everyone. Enjoy the rest of your evening and enjoy your weekend. Goodbye, everyone.